A few years ago, I watched an Oscar-winning documentary, Under Our Skin. It is a documentary about chronic Lyme disease and the controversy surrounding the treatment. It was an interesting film, but I don't see how someone like me living in California needs to worry about it. After all, most films spice up everything to get the viewer's attention, right? Maybe even a documentary like that. However, I was shocked when I met Miss Rui, who was infected with Lyme disease 12 years ago. She was in perfect health before contracting it, but has been suffering the consequences since then. Miss Rui loved to sing, but now with Bell's palsy as a Lyme's consequence, she has problems even to smile. Already she is considered lucky to regain a normal life. Lyme disease destroyed her once perfect health. And then I spoke to her husband, Dr. Tim, who is a retired medical doctor in the field of laboratory medicine. To my surprise, Dr. Tim contracted Lyme disease 10 years ago when he was in his 70s. But with his medical knowledge and experience gained from battling Lyme for his wife, he is 100% healed. Dr. Tim had a lucky break because he was checked for Lyme disease on day 1, although very few cases were reported in upstate New York where they lived, while Mrs. Ruiz was not tested for Lyme disease till 5 days after the fever broke out. It is a sad story, but not an uncommon one. Most people who suffer from Lyme consequences or develop chronic Lyme disease fail to get proper treatment right away. Ms. Rui and Dr. Tim agreed to be interviewed for this documentary to raise awareness about Lyme disease. I called Lyme a killer in disguise because people fail to get proper treatment when Lyme symptoms are often ignored and overlooked, thinking that it is symptoms of flu, allergy, or stroke. Ms. Rui, can you tell us a little about what happened?
It started with fever, so I took Tylenol. It did not help. After 2 days, I felt so weak. I had to stay in bed. My husband was busy with work, and when I got worse, he noticed this ring on me, although we contacted my family doctor and requested a Lyme test. It was 5 days too late.
It is very true, as most people would never suspect Lyme disease unless you are warned or live in an outbreak area, like in Connecticut or New Jersey. This is a map of recorded Lyme cases. Please note, even if you do not live near a high-risk Lyme area, there is still a chance you could be infected. Lyme disease is a tick-borne disease. It is transmitted to humans by the bite of infected ticks of the Ixodes genus. What to do if you're bitten by a tick? Basically, you have 3 choices. Observe and treat if signs or symptoms of the infection develop. Please note that Miss Rui's tick mark did not appear till about 4 days after she had a fever. So if you want to take this approach, watch for every symptom and take immediate action. Number 2, seek medical advice and take a Lyme diagnostic test. Number 3, the third choice is treat with a preventative antibiotic immediately. Please note the most common Lyme disease test these days is a 2-tier testing system. The CDC recommends that doctors first order an ELISA to screen for the disease and then confirm the disease with a Western blot. However, during the first 4 to 6 weeks of Lyme infection, these tests are unreliable because most people have not yet developed the antibody response that the test measures. Even later in the illness, half of the Lyme-infected patients can't be screened by this test. A second test is then used to make sure that only people with the disease are diagnosed. But the two tests still miss roughly 54% of patients. This is from www.lymedisease.org. That is why some people choose option number 3, the preventative treatment. You have to admit, none of this sounds like anything you want to experience. Maybe the better way is not to be bitten by ticks. How do we prevent tick bites? How do you know it is a tick that bit you? To avoid ticks, you must avoid heavily wooded or bushy areas. Use insect repellent. Look for ticks when you are back inside. Take a shower within 2 hours. Wash and dry clothes with high heat. And now, take a look at this ugly beast called a tick. Miss Rui, before your symptoms appeared, did you see ticks? Or feel a tick bite?
No, I did not.
Had you been close to animals like deer? Or had you been through bushy areas?
No, but deers do sometimes run into my backyard.
Thank you, Miss Rui. As I called Lyme the killer in disguise, victims like Miss Rui were not even aware of being bitten by a tick. We must raise the awareness to lower the risk. Now let's take another look at Lyme disease symptoms. You must be aware of the first few symptoms of Lyme disease. A small red bump often appears at the site of a tick bite or tick removal and resolves over a few days. This is normal after a tick bite and does not indicate Lyme disease. A rash from 3 to 30 days after an infected tick bite, and there may be flu-like symptoms such as fever, chills, fatigue, body aches, and a headache may accompany the rash. And the latter signs and symptoms are the following: erythema migraines, an expanding area of redness appearing in other areas of your body, joint pain. Bouts of severe joint pain and swelling are especially likely to affect your knees, but the pain can shift from one joint to another. Neurological problems. Weeks, months, or even years after an infection, you might develop inflammation of the membranes surrounding your brain, which is meningitis. Temporary paralysis of one side of your face, which is Bell's palsy. Numbness or weakness in your limbs, and impaired muscle movement. The symptoms caused by the bacterium Borrelia mayoni may also include nausea and vomiting, diffuse rashes. Some people even develop these less common signs and symptoms. It may happen several weeks after an infection. Please watch out for heart problems, such as an irregular heartbeat. Heart problems rarely last more than a few days or weeks. Eye inflammation, liver inflammation, hepatitis, severe fatigue. Now that we know how horrible Lyme disease is, how can it be treated?
If you remove a tick from you and find it full of blood, that means you may be infected. So, a single dose of doxycycline may be used to prevent development of infection, but is not generally recommended since development of infection is rare. If an infection develops, a number of antibiotics are effective. including doxycycline, amoxicillin, and cefuroxime. Treatment is usually for 2 or 3 weeks. Some people develop a fever and muscle and joint pain from treatment, which may last for 1 or 2 days. In those who develop persistent symptoms, long-term antibiotic therapy has not been found to be useful.
The pain Lyme disease patients have to go through is unimaginable. Prevention is probably the best defense, but it can't be done without awareness. Miss Rui's neighbor, a young boy, fully recovered from Lyme because Lyme disease became the prime suspect after they heard about Miss Rui's horrifying ordeal. And after talking to Miss Rui, I have to wonder if we should rely heavily on government reports of Lyme cases. If Miss Rui, the doctor, and their neighbor all contracted Lyme disease, is the risk in the low-risk area as low as we once thought it to be? Please forward this video to people you care about. And please search for helpful information on Lyme disease. By raising awareness and preventing exposures of unnecessary risk, I am sure you and your healthcare professional can win the battle against Lyme disease. This is Ken Peters. Thank you for watching.